ช่วง Med in Focus นั่นเองค่ะซึ่งวันนี้เนี่ยเราจะมาพูดคุยนะคะเกี่ยวกับท็อปิกที่มันเป็นท็อปิกใกล้ตัวอีกแล้วค่ะ metster เรื่องราวเกี่ยวกับสายตานะคะภายใต้ท็อปิก better vision better life แน่นอนสายตาดีชีวิตเราก็ดีค่ะ metster ซึ่งวันนี้นะคะเราจะพูดคุยกับดร.ธารินี เสงี่ยมพรพาณิชย์นั่นเองนะคะคุณหมอจะมาพูดคุยให้ความรู้นะคะเกี่ยวกับเรื่องราวของสายตาดังนั้นแล้ว metster คนไหนเนี่ยมีคำถามหรือว่ากำลังตัดสินใจที่อยากจะทำเลสิกอยู่นะคะแล้วต้องการข้อมูลเพิ่มเติมฟังตอนนี้เลยนะคะแล้ววันนี้เนี่ยเรามีเป็นอินฟลูเอนซ่าวัคซีนนะคะ2รางวัลมาแจก metster ด้วยดังนั้นแล้วใครที่ฟังอยู่แล้วอยากจะได้รับของรางวัลนะคะอยากจะให้แชร์ Facebook ของเรานะคะแชร์ Facebook Live ตัวนี้เปิดเป็นแบบ Public นะคะแล้วก็ทิ้งคำถามไว้ค่ะซึ่งจะเป็นคำถามนะคะคำถามที่เราเอาไปใช้นะคะผ่านทางในการพูดคุยใน Facebook Live นั่นเองนะคะเดี๋ยวให้คุณหมอเนี่ยเตรียมตัวสักคู่หนึ่งนะคะเดี๋ยวตอนนี้เดี๋ยวคุณหมอเตรียมตัวแป๊บหนึ่งนะคะให้ metster ได้ทำการแชร์ไลฟ์ของเราไปก่อนนะคะเผื่อใครที่แบบว่ามีคำถามอะไรก็ทิ้งไว้แล้วเดี๋ยวเรามาเจอกันอีกแป๊บหนึ่งในช่วง Med in Focus ค่ะ we're back again with Met in Focus, and today we're going to be talking about eyesight problems under the topic of better vision, better life, and the solution of taking care of eyesight with Dr. Tarinee Sa-Ngiampornpanit นะคะ She is the Ophthalmology Director of Eye and Lasik Center from Bangkok Hospital. I do say that, I must say, eyesight is a problem, a very common problem that cannot be avoided, such as myopia, hyperopia, and astigmatism. These are the problems in the daily life. We're going to get to know more about it today. สวัสดีค่ะ Dr. Tarinee ค่ะ
สวัสดีค่ะ Good morning.
Good.
How are you?
We're great. Today we have questions coming in about eyesight problems. I do believe that everyone has some sort of eyesight problem, whether it's a short-sighted or long-sighted or somehow, because we use our eyes every day. But first and foremost, I would like to know what are the most prevalent eye conditions that tends to affect individual in the working age group.
Okay, so most of our lifestyle right now, we are in front of the computer screen. So I have lots of patients in the working group that have a problem with the computer.
Right.
There's a term which is called computer vision syndrome, which is related with the screen using not just only the computer, but just smartphone, everything, which is like something which is we live with it from the beginning of the day until the end of the day. So when we use computer screen for a long time, we can have a tired eye,
right?
Because we blink less and we just pay attention with the screen and we work with it all the time. So we have less blink, so we have dry eyes. And also when we use it for a long time, we can have problem with like eye strain, double vision, or feel like foreign body sensation, or didn't want to use the eye anymore. This is very common. So there are so many patients who come with this problem. So when I see the patient, we just look at, is there anything else that is correlate with, like, is there anything in the eye which have problem? But most of them in the age which is like still young, right. Working age group, they still don't have any much of the eye problem, but mainly is related with the work. So I usually recommend the patients for having a rest between using. So there's a rule like 20-20-20 rule, which is recommended from the WHO.
Right.
Every 20 minutes of using the computer screen, we should have a rest for about 20 seconds by closing your eye or looking at something far away about 20 feet.
Mm-hmm.
But actually this is like 20 minutes and then you need to stop. I think it's too short,
right.
for us in the real life.
Uh-huh.
So at least you just keep in mind that like you need to rest. It's just like when you run a long time in a long distance without any break. Finally, you will get tired by the end of the day.
Right.
So this is one thing which is like a gimmick that I usually tell the patient. And
right.
also maybe you need to like remind yourself to rest and remind yourself to blink sometimes, because when the eye open for a long time, it's dry. So
right.
when you blink more, if you rest, it will be better. Because if it's very dry, sometimes it's blurry and you cannot, like, you don't want to use the eye anymore because it's like, oh, it's too tired, which is very common.
Right.
And also we wake up with the smartphone and we end up of your day with the smartphone.
Every
so this
day.
is one thing which is, I think is very common, because right now we just addict to it. I think this is very common. So we need to, this is like in these pictures,
mm-hmm.
if
right.
the smartphone in the nighttime, actually the ambient light should be bright as
mm-hmm.
well. Because if you stay in the dark and you look at the computer or smartphone, the light from the smartphone is also like too bright. Right. So you can have more like tiredness. Yeah.
So these are the main common problems that we see in a working age group. Apart from backache, also your eyes get very tired as well from.
Yeah, and also your neck, or like you have a computer.
The office
syndrome. Yeah, some
yes.
kind of like office syndrome.
Yes.
That eye is one of the problem. Mm-hmm.
Right. So that can lead to eyesight problems. And it well, it might not be too common for younger kids to have really bad eyesight, but for people who does have bad eyesight, they might want to consider LASIK. I would like to get to know more about LASIK and about their latest advance in the LASIK eye surgery. How is it going on now in the LASIK world?
Actually, there are so many type of LASIK in our hospital. We have the latest technology is Relax Smile, which is the small incision one. If you have short-sightedness or astigmatism and you don't want to wear glasses or contact lens,
right,
this is the choice. We have Relax Smile, which is the small incision or laser, no blade, and also no flap.
Wow.
But you might know like LASIK more, like you might familiar with LASIK. Actually, LASIK. There's a flap, which we need to cut the cornea to open the flap, and then we do the laser to correct the vision. But about LASIK, we also have femto LASIK, which is the bladeless, no cutting with it's all laser, no cutting with the blade anymore. So it gives you more safety in during the procedure, and also after the surgery, everything will be better than use conventional blade. And also intra operation, the complication is less. And also we also have PRK, which is the old fashioned ones. Like actually our LASIK center have many type of surgery. And also if you don't want to have contact lens wear because you have very high short-sightedness and you cannot do LASIK or you cannot do Relax Smile, we also have it's called ICL, which is the implantable lens, which is implant into the eye to correct your very high short-sightedness or astigmatism as well.
It's super advanced.
Yeah.
It's super advanced nowadays comparing to before.
Yeah, because it's like everything is towards small incision. So right now, Relax Smile is the main procedure that we do in LASIK center. It's the newest technology. But Relax Smile can only correct the myopia and astigmatism. If you have long-sightedness or hyperopia, you still need to have LASIK. But we have femto LASIK, which is bladeless, which is very safe as well.
Right. We're going to get into depth about it in our Facebook Live. But before I let you go today, I would like the doctor to คุณหมอนะคะ to recommend daily practices, the do's and the don'ts for mesters that are listening right now before I let you go.
Okay. One thing is like I don't recommend you to use the smartphone in the nighttime without any light.
Without any
with
light.
Contact lens.
Right.
No. Contact lens is sleep with the smartphone. I think is one of the things which we don't want you to do because it will make your eye more tired. And also when you expose to the bright light from the smartphone, that's some kind of blue light as well, which is actually is not a lot, but it might affect with your sleep. Because actually before sleep you shouldn't use the smartphone. At least the recommendation is like 2 hours before you sleep, because if you like stimulate by the light all the time, you won't sleep well and maybe you wake up in the middle of the night.
Right.
And about the do things, I think we are in the tropical country. We have lots of sunlight. So there are so many like disease which is correlate with the sunlight, such as like pinkecular, which is like ต้อลม or pterygium, which is ต้อเนื้อ. I think recommendation is you should wear sunglasses when you go outdoor, or if you have outdoor activities, sunglasses help you to protect the eye from the UV light, because there are so many disease which is caused from the UV light. And another common thing is like, this is the common question that patients usually ask me about, like the blue light glasses. Right. I think this is not mandatory that you need to use in every single patient or every single person. But I think it's better to have the 20-20-20, because like rest between using, because right now the computer screen, the smartphone, the emission of the blue light is not a lot, but if you expose it for a long time, it might cause you tired. Right. But so you need to rest.
So thank you so much, Dr. Tarinee นะคะ we're gonna continue our session live, but for now, I'm gonna have to sign out for our Medsters on air right now. ขอบคุณคุณหมอนะคะ
Yeah ขอบคุณค่ะ Thank you สวัสดีค่ะ
All right. For those of you who still has questions for Dr. Tarinee, you can basically watch the Facebook Live after this or consult her at the LASIK Center at the Bangkok Hospital. Special thank you to Dr. Tarinee and Bangkok Hospital. For now, Bangkok Hospital, hello, sawadee, to a healthier you. Bangkok Hospital is here. Stay fit, boost brain power, and embrace your mental health. If you are health conscious and keen on achieving excellent health, do not miss out, Medsters. Right now, you can sign up on their event, which is on the 9th of September during 2 p.m. to 4 p.m. at Movenpick BDMS Wellnet Resort. Key highlights includes the health talk by expert specialists, free on-site health consultation in sports medicine, orthopedics, and internal medicine, sleep and mental health, ensuring a wonderful evening ending with a cocktail treat. For those of you listening right now and is interested for registration, check out Bangkok Hospital, Facebook, and Instagram for more information. Contact Mr. Ralph Kruer. The number is 02-755-1696. I repeat, 02-755-1696. Stay fit, boost brain power, and embrace your mental health. คุณหมอคะ
สวัสดีค่ะ
โอเคเดี๋ยวเรามาต่อกันใน Facebook Live นะคะเมื่อกี้ก็คือมีหลายประเด็นเหมือนกันที่แบบว่าอยากจะพูดคุยต่อนะคะ just now talking about LASIKs, the newest technology where you don't need to cut it open anymore. It's just small insertion and just laser. And after you get them done, do we still do the same procedure as the old school LASIK style where you need to have your eyes closed all the time, or you're good to go? Or do you need to stay away from the light?
Okay, so Relax Smile have a very speedy visual recovery, but the care after the operation is not much different from LASIK because like you should be aware of the water that it's going to the eye because there can be a risk of infection. It's the same thing, but the risk of having infection is a lot less because it's small incision. It's about like 5 times less than conventional LASIK because it's just like a keyhole thing. It's just like the whole flap. And also the protective shield at night. We still recommend the patients to do it. But actually, it doesn't much matter. But because we have lots of patients in LASIK center, so the recommendation is the same thing. But for Relax Smile, actually the wound is so strong, so it doesn't much matter. But for easier to communicate with the patient, so just let them wear the night shield only. But in the daytime, like the day after, you can use smartphone that you cannot use on the first day, like immediately after the operation, the vision might be a bit foggy. You cannot use the smartphone, but the day after you can see and you can chat with other patients.
How long does it take? How long does it take for your eyes to recover after the surgery?
Actually, immediately after the operation, you can see, but it's foggy. But the day after, most of the patients will say that they can see about like 80 to 90% because it's still dry on the first day and they're still on the period of healing. But they can go back to work on the day after the surgery. But we still recommend patients to wait for about like 2 or 3 days before return back to work. But no need to like stay in the dark room or stay at home. You can have active life, but just only beware of the water that go into the eye.
Right.
And antibiotics eye drops only. Yeah.
And after you got them done, how long till your eyesight comes back again? I mean,
like fully recover?
No, I'm sorry. How long will it last? Because eventually, somehow your eyesight would be damaged from your daily usage anyways. How long can that stay with you?
Normally, the LASIK or relax, we usually recommend the patients at about age of 20 to 50. Because in this period, the eyes is pretty stable. But so let's say if you do it at about 20 or 30 years old, you will be glass free until you are 40 because LASIK, it helps you to correct the vision at your age as well. When you get older, finally at like 40 years old, if you have presbyopia, you still need reading glasses.
Right. So
when you get older enough, such as like 60s, 70s, you still have something which is aging, like gray hair, you still have developed, right? So in the eye, the cataract, which is the lens opacity, will be developed. But LASIK is not aggravate the problem. So it means like you still can use the eye without glasses for a long time until the period that you get old.
Right. Yeah. We have questions coming in from our listener from คุณเยาวลักษณ์นินิวสัมพันธาชิตสุดท้าย she says ต้อตาลมสังเกตยังไงคะอันตรายมากแค่ไหนถ้าทิ้งไว้นานข้อแตกต่างระหว่างต้อเนื้อและต้อลมแตกต่างกันยังไงคะถ้าสังเกตโดยผิวเผินค่ะคุณหมอ
คือถ้าso if it's pingular, which is ต้อลม is the degeneration of your conjunctiva from the UV light. It will be if you have a cornea, which is like the ตาดำนะคะ Okay, the ต้อเนื้อ will be just beside on the white part of the eye. It's not invade into the color part of the eye. But if it's ต้อเนื้อ which is called pterygium, it will invade inside the color part of the eye because we have like our cornea is black in color, but actually is the iris color, which is we have brown color, so we call ตาดำ which is like the cornea. So different is ต้อเนื้อ is invade. You can see that there are some part of your black like central part, the cornea, your ตาดำ that there's something invade inside. It's just like a triangular shape that is invade into the round black color. But if it's ต้อลม, it does not invade yet. But actually this one, I usually tell the patients that it's just like sisters. If you go beyond the edge of that, the cornea, we'll call pterygium. But if it is not invade yet, it's called pingular, but it's the same cause. It's from the UV light that damage your eyes. It's not the tumor. It's not like the bump or anything which is like relate with any like cancer or anything.
We have next question from คุณแจมรัตนาชีวรมีแพลนจะทำเลสิกค่ะถ้าต้องตัดเนื้อกระจกตาออกประมาณ 45% ในความคิดเห็นคุณหมอมันเสี่ยงต่อกระจกตาด้วยได้มากไหมคะควรตัดสินใจอย่างไรดีและภาวะกระจกตาย้วยถ้าเกิดขึ้นแล้วมีการรักษาไหมคะขอบคุณค่ะ
Okay, so the first question about the thickness of the cornea. Normally we have like each eye, like different people have different thickness of the cornea.
Right.
So the way to do relax or LASIK, we need to remove some part of your tissue out. So we need to respect the thickness because the eye is like a ball, right? If we ablate the cornea or if you remove more tissue in some part of your eyes more, it can have a problem, which is called ectasia or keratoconus or like actually it's not keratoconus, it's called ectasia or กระจกตาย้วยที่that she mentioned. So it's just the guideline that if we remove the tissue more than 40% of the total, it might be more risk. So in patients who have have thin cornea, have very long refractive error. So we might suggest to do other things such as the ICL. But this one, it just depends on each patient. Right. Because if we remove the tissue a lot, there's a risk of กระจกตาย้วย there's a risk of it's called ectasia, which is like the thickness that is left after the surgery is not strong enough to maintain the integrity of the eye, so it just keep protruding. So the vision will change will get worse and worse. You might have more short-sightedness and also have more astigmatism if you have กระจกตาย้วย but it is treatable as well. But actually, it's better to prevent something like this to happen. So this is why before you have LASIK done, there are so many tests. It takes like 3 to 4 hours to come to the LASIK center. Lots of measurement, lots of things that you need to do before that. We like after the whole bunch of investigation, the doctor will discuss with you that what is the pro and con for this type of surgery and what is the suitable surgery that is suit your eye. And each doctor might have different, like because it's not like every there's a guideline, but there are some variation as well. So it depends on each patient.
ค่ะ right คุณหมอคะ there's this the latest trend going on that it frightens me a little bit to see people do it about changing your eye color to gray.
I personally don't recommend it yet. Like change the iris color.
Yes.
I think it's too invasive. Yeah. You can wear the contact lens, which is the colorful contact lens.
But
like the tint contact lens, which is make your eyes like bigger eye, or that one is safer. But actually, it's not safe. Your natural eye is safe. Is the safest, right?
I mean, like I feel like it's so new.
Yeah. So, but there's like if you want to change your eye color, I think it's better to maybe just use the fashion contact lens from time to time. It might be safer because changing the iris color, I think is too invasive. It's like we still don't recommend.
Don't mess with it. Don't mess with it.
Too aggressive, I think.
Too aggressive. Yeah. And lastly, is there anything you'd like to say to the mesters listening now, deciding to work on their eyesight problems or wanting to come and consult with you in Bangkok Hospital?
I think in this age group, in the young age group, like in the audience of Med 107.
Yes.
So like I think computer use is one of the things that is very common. It's not severe. It's not affect, like it's not like a disease which is like very harmful, but we can prevent and we can live with it because because I think right now we cannot live without computer screen like in every day. So we need to live with it peacefully. So and also our eye is very important. So use the eye and you need to rest. And you can use tears from time to time if you feel dry because dry eyes from the computer is very common and it can cause more problem if you if you don't pay attention to our eye health. I think prevention is the best. I think treatment is not but if you have problem, we are happy to treat you. But I think prevention is one of the things that all the doctor usually recommend to the patient.
กันไว้ดีกว่าแก้
Education and everything. Yeah.
All right. Thank you so much, Dr. Tarinee Sa-Ngiampornpanit, Ophthalmology, Director of Eye and Lasik Center from Bangkok Hospital, for coming here today and giving us all the knowledge we need to know about our eyesight. Thank you so much. ขอบคุณนะคะคุณหมอ
Thank you ขอบคุณนะคะสวัสดีค่ะ
สวัสดีค่ะ and also thank you to Bangkok Hospital. Right now they will be having an event, so Metsters, if you guys are interested, it is on the 9th of September during the 2 p.m. to 4 p.m. 2 hours straight at the Move and Pick BDMS Wellness Resort. Key highlight includes health talk by our expert specialists and free on-site health consultation in sports medicine, orthopedics, internal medicine, sleep, and mental health, ensuring a wonderful evening. And we will be ending it with a cocktail as well. For registration, check out Bangkok Hospital Facebook and Instagram. For more information, contact Mr. Ralph Kruer, and the number is 027551695. Hello, sawadee to a healthier you. Bangkok Hospital is here. Stay fit, boost brain power, and embrace your mental health. For now สวัสดีค่ะเดี๋ยวไปเจอกันนะคะใน On Air และใครนะคะที่พลาดการติดตามวันนี้ไปสามารถย้อนดูได้เลยผ่านทาง Facebook ย้อนหลังค่ะวันนี้ไปก่อนนะคะบ๊ายบายค่ะ